Hello, all. Change is inevitable. You have actually changed from this to this. You changed from this manual to automatics. You changed from the film developing stuff to RVGs. You changed from the bleeding involved scalpel blade to lasers. Changes are happening. Change is inevitable. Corona has brought about an even bigger change. I don't think you can see waiting areas crowded like this anymore. Things are changing that way also. Before you see this much of crowd, oh my god, that doctor inside is something. Look at the amount of rush. Now it's changed. People run off from there. You might even get phone calls. Doctor, I came there. I saw so many slippers. I went off. Doctor, call me. Give me a time. I will come at that time. Guys, change is inevitable. Clear aligner versus conventional straight wire bracket is another topic which is part of change is inevitable. My topic today is on the advantages and disadvantages of clear aligner quickly so that you can choose. Directly going into a patient, 25-year-old female, an air hostess, 25-year-old air hostess with a complaint of crooked teeth. 25-year-old females normally will be very clear on their problem. They will tell exactly what are they looking at. So this female was very clear. I just want this teeth to be corrected, which is like this. I'm not happy. My boss said that she's working for an airline, so she wants it to be corrected. But she can't put braces. Have you seen any air hostess with braces? So I had to go for clear aligners here. Look at the model analysis. 4 millimeter, -4 crowding in the upper, -5 crowding in the lower, which indicates there is severe space discrepancy. We need space. And that's the OPG, and there's a CEF. And CEF analysis shows SNA, SNB difference of 3, which is actually skeletally perfect. IMPA 92, which is again showing that the lower teeth are pretty much upright in the socket. Now, why am I showing all these cephalometric values and all? Yeah? You guys are listening to clear aligner lecture. You thought it is so, clear aligner is so simple. But why am I showing more model analysis and cephalometrics and all that? There is a reason for that. I'll talk about it at the end of the lecture. So this patient, we decided to go for clear aligner treatment. No change for her. Profile untouched. She doesn't want a change in profile, so I didn't change the profile. Untouched. But the anterior crowding, including lower, corrected pretty much nicely. That's the upper arch crowding corrected. That's the lower arch. Lower arch, if you look at it, not 100% corrected, but pretty much corrected for her satisfaction. Clear aligner versus conventional braces. What are the advantages of clear aligners? Let's directly go to advantages. First of all, let me tell you, the moment you say there are no braces, the moment you say there are no braces, that means there is no bracket placement. If there is no bracket placement, there is no bracket placement error. And then no bracket popping off issues. No wire. The moment there is no wire poking here and there, nothing. Cleanliness, so easy, no hygiene issues. Advantages go all the way, over and over like this, because the moment there are no braces, advantages are like increasing like this. Then adults and celebrities. Yeah, no brackets, no wire. There comes importance of treating adults and celebrities. Retreatments. And the moment you say adult, it will be almost always retreatments, or I had done braces when I was in my 10th standard. You can hear all that. So retreatment is another area where clear aligner has a real upper hand. Let's look at the type of movement. Type of movement, what exactly happens when you do this clear aligner? You should understand that. Simple, basic stuff. You take an impression and send it to the lab. The lab guys digitize the cast. So now you have a digital cast in the computer. It's 3D CAD/CAM technology we are talking about. And then individual teeth come under the control of the technician. Every teeth has a handle now. The green thing is a handle. They can tilt and move the teeth any way they want. and they can hold on to one teeth and move it to one side. Look at that. They can expand it a little. See this side. You can see this side, molar taken out a little, expanding a little. Everything can be precisely done in the computer. Once that all the movements have been done, then there is something called as 3D printing. The whole thing is being 3D printed. And you get 3D casts like this. And then, you know what? You can't do the complete correction and make a 3D print and make a tray and give it to the patient. It won't even fit into the patient's mouth. So you have to do little bit of movement, make a 3D print, make a tray. Little more movement, 3D print, tray. Little more movement, 3D print, tray. So that's a sequence of trays there. So the point here is, these are the multiple stages we are talking about. Multiple 3D prints will come out. Stage 1, stage 2, stage 3 like that. Tray 1, tray 2, tray 3, tray 4, tray 5 like that. And once all the trays are ready, they are ready to make a 6 retainer or a simple plastic tray. The conventional S6 retainer is now made over each 3D printer. So tray 1 is designed to move only a very little movement. Tray 2 for little more movement. Tray 3 for little more movement. So what I mean to say here is, this is a sequential program. Every month patient has to go to the orthodontist to tighten the braces or change the wire. Here, no tightening, no wire changing. Just have to change the tray. Tray can be changed by the patient himself or herself. They don't have to come to the clinic to change the tray. So that's the tray being there. That is a huge advantage there. There is nothing fixed. It is all removable trays only. Another advantage I want to talk about is the movement is actually faster, because this actually follows the correct methodology of light continuous force, because very minute movement is being made in the computer for each tray. So it's very light force, and that way you look at it, it's faster than the conventional one. So that case which I showed you, when conventional straightware ortho, it would have taken 1 year to 1 year and 2 months or 3 months. This takes hardly 6 months to 8 months to get corrected. So it's definitely faster. Yeah, this took around 6 to 8 months. That's it. Another advantage is no geographic barrier. What do you mean by that? If you have a patient in America, you can do that. Just send me the cast or send me the 3D print. I mean, send me the intraoral scanning image as email. We can make tray and courier it to you. So there is no geographic barrier anymore. Patient can be from any country. I'm working on patients in America, in Australia, a lot in Europe. So possible. But obviously they have to come once. Kerala is a place they all come once as a tourist. So I meet them, I see the condition, take impressions, arrange trays, and then keep sending the trays to their own countries. They don't have to come to me. No geographic barrier. And in between, if they lose a tray or there's some changes to be done, all they have to do is to go to any clinic in their own country and get a intraoral scanning done. That's a video of intraoral scanning. Guys, change is inevitable. Things are changing. Less than 30 seconds, you can see the whole mouth, the whole upper arch is being scanned beautifully with a toothbrush-like device. Look at that. It's only 15 seconds now. Less than 30 seconds. Whole palate, everything will come with a toothbrush-like device. He's doing it himself. It's that simple. You don't need a dentist actually, but the instrument is costly. You want to go to a dentist. That's a full art done. And just click, attach, and email comes to me. I can send it to my lab. The lab guys can immediately make a 3D print out of it and make trays over it. What technology! Just amazing. Change is inevitable. Another advantage I would say is something called as whiten as you straighten, because these trays are the trays you use for bleaching, something like bleaching trays. So as you put the tray, put a little bit of home bleach inside and put it in. So you get the teeth straightened as well as whitened. Whitened as well as straightened. Any way you want to put it across. Possible? Strengthen as you straighten. What do you mean by that? That is the typical GC moves and all that you give to the patient. You tell you to put it inside a tray. That tray are we talking about here? So all you have to do is ask the patient to put GC moves inside and put it in. The teeth will get straighter, plus the hypocalcification part is being taken care of. So strengthen as you straighten. These are all the advantages of clear aligner. Guys, advantages are going on and on like that. I think it's high time I talk a little bit about disadvantages also. You know what is the biggest disadvantage? This is a removable appliance. Way back in your final year BDS, third year BDS orthodontics, you have heard about the advantages of fixed appliances over removable appliances. Fixed appliances is patient compliance. You don't need patient cooperation because it is fixed. Removable means patient has to wear it. Yeah, all that thing comes here. This is a removable appliance. As long as it is a removable appliance, the patient is not wearing it. Patient is not wearing it. You had it. No change is going to happen. So it is a disadvantage because it's a removable appliance. But let me tell you, in the last 17 years of my practice doing clear aligners, adults, celebrities, they are in need for it, they will wear it. It's not like giving a 8-year-old a removable frangle or a twin block and saying that it's removable, that's why the patient is not wearing. This is not that. We are dealing with adults and they need it, they asked for it, they paid for it. It's slightly costly, so they paid for it. So that is one disadvantage, but I wouldn't consider that as a disadvantage at all. Another advantage or disadvantage I would say is about you need to have some diagnostic knowledge. There comes the thing I told you beginning, I told you I will come to about it at the end of the lecture. You need to know basic diagnosis. You have to know what to move, where to move before you start this. Let's look at one more case quickly. This is an upper lower arch crooked teeth. That's upper arch. Upper arch pretty much okay, -4 millimeter. Lower arch -7 millimeter according to model analysis. That means 4 millimeter only required in the upper, but lower requires almost 7 to 8 millimeter. That's a lot of distance, the space. Upper 4 millimeter can be easily achieved by, if you can see my mouse movement here, upper 4 millimeter can be easily achieved by getting these premolars out a little. This premolar out. Little bit of widening, arch widening, you can easily get that. So it's not an issue at all when it comes to upper. But look at the lower, -7. Premolars already pretty nicely wide. I don't know what you can do about it. So, and then look at the cephalometric values of this case. Incisor-mandibular plane angle is already normal is around 90 to 94, and that this particular case is 95, which is all indicating that the lower teeth is already slightly proclined, and you don't want to further flare it out. If you flare it out further, it can be unstable. So, in this particular case, options you have is something called as IPR. So you have to know a little bit about interproximal reduction. In IPR is interproximal reduction, wherein you gain space by trimming off a little bit of enamel here and there. Not to be done with aeroter here and there like that. That area is going to end up in a cavity for sure. You got to go with proper professional IPR kit. And then proper fluoride therapy, GC moves, so all sorts of preventive methodologies to make sure it doesn't become a caries. Because in our country, in India, the biggest problem is they come to you only when they have pain. They won't come to you with a small black patch here and there. So make sure you do the preventive part the moment you touch enamel like that. In this particular case, instead of enamel stripping on all the lower teeth, what I did is I decided to remove one lateral incisor. One lateral incisor removed. Look at the video. This is the video the lab guys will give you to show you how the treatment will look after, how the patient will look after treatment. So this is the lower arch, severely crowded. I decided to go for one teeth extraction here. Instead of enamel stripping on all teeth, I thought, do not touch enamel, take out one teeth, sacrifice one teeth and correct it nicely like that. That was what done in this particular case, profile untouched. He's just the same, but look at his lower anterior, one teeth is missing. This is upper arch. As I told you, I just expanded a little here and there. See, look at that expansion, and is done and fine. But lower arch, I took out one teeth. He has only 3 incisors from now on. No issues with that. That's acceptable. But you're avoiding unnecessary enamel stripping on all teeth, and you took out one teeth. So for all that, you need to know about model analysis. So I don't know model analysis. Read, learn. You got to know a little bit of basic cephalometrics, a little bit of model analysis before you venture into orthodontics. Because don't think it is a very, very easy ball game. But that concept of tray, my God, it is easy. Initial diagnosis, which tooth to take out, where to move what, you got to have an upper hand there, not the lab guys. And that one particular case I did was a celebrity, and she never wanted that extraction space to be shown because shooting's going on. So what we did is, with trays, we kept on moving teeth inside. The teeth went inside. Tray 1, tray 2, tray 3, tray 4. What was happening? We didn't extract. Instead, one teeth, one fellow. Look at one fellow going inside. Once it's completely inside, and once the spaces in the front is completely closed, now you can extract. It will not affect her shooting. So this is the advantage of clear aligner. You can do any specific movements you want without affecting their career, without affecting their jobs. One last case. Actually, you have to comment about it, but in this platform, your comments are not possible. Let's see. This is a patient with an upper arch, pretty nice wide arch, upper arch, very mild crowding only, nothing to worry much. Can be easily aligned with clear aligner, easily aligned with clear aligner. Lower arch, too much of crowding. Too much of crowding. So lower arch will definitely require maybe one central incisor extraction so that I can align everything. So model analysis wise, upper arch, lower arch, you're fine. You can do something about it. But here is a catch. This is his upper lower put together. What is seen here? Don't look at just upper arch and lower arch and come to a decision. Put it together, see what's going on. That's a skeletal case. Adult with a skeletal crossbite. We are talking about a different story altogether. And we have to take, this is her side view. Look at her x-ray. SNA-SNB difference of -6, which clearly indicates a severe mandibular prognathism. That is a class 3 skeletal. These kind of stuff, do not try with clear aligner. This is going for orthognathic surgery. She had to get her whole mandible back to get her profile corrected. That's orthognathics there. What I mean to say here is, you got to be having an idea about the complete diagnostic tools. You can't just depend upon the lab guys. You can't just give an upper cast. The moment the lab guys see the upper arch, oh, it can be easily aligned, sir. Just 10 trays, I'll align it. But they don't know what's actually happening there. She has to live with those plates rest of her life, no other go. But what I'm trying to convey here is, it is your decision how to go forward in clear aligners. Another disadvantage I would say is that you need to have good connectivity with the patient. What do you mean by connectivity? You got to be in touch with the patient. In that way, it's a big disadvantage because the conventional orthodontic patients, you put a wire and modules and leave the patient. Next 1 month, you don't have to think about the patient. You don't have to talk to the patient. You don't know anything. All you have to do is next month, patient will come. We can put the next wire or the next elastic or whatever. But this is not like that. When they try to put tray 2, sir, tray 2 not going in, you will get phone calls. I get WhatsApps regularly from these patients. Hello Priya, it's time to change from tray 8 to tray 9. Please feel free to contact me. That is like the time of tray changing. All my patients get an SMS saying that it's time to change to the next tray. Otherwise, they might forget. So it's your duty to make sure they wear the next tray on that particular day. What is this? Please send a picture of the front teeth to see and evaluate the changes. Yeah, from Australia, they send picture of the front teeth so that I can know what are the changes happening. Is it happening nicely? Lots of connectivity issues. A lot of communications are required. Don't think that this is like a lot of money making, easy money making, nothing like that. This is the same headache as conventional ortho, maybe more headache as conventional ortho, but no bracket propping off, no hygiene issues, no wire poking. So much of advantage. If you're way between both, is no doubt clear aligner is overruling conventional straight wear orthodontics. So here is a summary of the disadvantages. That's it, guys. Some final thoughts about clear aligner. Is this an alternative to braces? I really don't think so. It's a complete alternative to braces, because those cases which require braces and need braces, those skeletal cases, those heavy movements required, those 4 bicuspid extraction retractions, bimaxillary protrusions, you are talking about braces, not clear aligners. Are labs taking over orthodontics completely? That is another thing. Yeah, lab guys are overruling now. That should not be allowed. You should have a clear idea about your diagnosis. You should decide what is your diagnosis. You should decide how to go forward, not the lab guys. So to conclude, I just covered the major advantages and disadvantages, the importance of the diagnostic knowledge here, importance of proper follow-up here, and the cost factor a little bit on IPR. That's all I could do. End of the day, I am concluding with what I started. Change is inevitable. You got to change. If this monkey and this dog can change in the lockdown period, anybody can change. Thank you very much, guys. Please feel free to contact me. Here are my details: Insta handle, Facebook, email and WhatsApp. Please contact me personally. Will guide you individually on cases if you want. Thank you very much.